So it's my pleasure to introduce Donna Rabin, who is running for position 5, Bay Area Health District. Donna.
Hi. I was told I should provide you all with some background information. So just to introduce myself, I have lived in Coos Bay since 1981. I moved here at that time with my husband and our first daughter, who was 6 months old, and we came to accept positions as physicians in the community. I started practicing at North Bend Medical Center in 1981 as a pediatrician, and that practice continued until the end of 2009 when I retired. And during the time I practiced pediatrics, I also spent a lot of time working with the community in volunteer aspects with the school system and Head Start. Anyway, I got to know the community very well during that time. In 2011, I joined the Bay Area Health District Board of Directors, primarily because I was really interested in continuing to advocate for healthcare. I wanted to stay involved. And I've been on the board since that time. I was a board chair from 2017 to 2019. And currently I sit on the Quality and Patient Safety Committee, which I think is an extremely important committee of the board. And I'm an active member of that. I've been on that committee for a number of years.
So some of these questions your answers might be somewhat redundant, but because we are going to be asking the same questions of your opponent, I'm going to start at the top. Why are you running for a seat on the hospital board? Describe your qualifications and experience.
Healthcare has been a major part of my whole life. I spent about 29 years taking care of infants and toddlers and children and young adults while practicing pediatrics at North Bend Medical Center. And during that period of time, one of the things I learned was that it is as important to help people stay well as it is to provide care for them when they're sick. And families really struggle with that. Adults really struggle with that. Access to health care is critical, and everybody in our community deserves great health care. And when I say great health care, I mean health care that is safe and high quality. Now, having said that, making that health care available to everyone is a huge challenge, especially in today's economy. I think we're making constant strides towards that, but it's an ongoing challenge. I'd really like to be able to continue to use my experience as a pediatrician and a community member and as a board member to continue to work towards achieving that goal.
Recruiting and retaining physicians and other health professionals can be a challenge for this area. What is the role of the health district in helping to assure that there are sufficient practitioners to meet the needs of the community?
That's a really good question, and that's a huge challenge. Much more challenging now than it was when I came here in 1981. The health district has created a formal hospitalist program at the hospital, and this provides specifically trained providers who admit patients and care for the mother in the hospital, allowing private physicians in the community to focus on outpatient practice if they choose to do that. Having that program available, and it's increased over the past few years, having that program available allows practitioners to spend more time focusing on seeing patients in their office. Having patients in the hospital takes a lot of time. So that helps access. Recruiting physicians is really tough. It's tough because of where we're located. It's tough because of the competitive market now. And it was tough at our hospital because we had on-call for physicians, which lots of folks graduating now do not want to participate in. So the hospice program is one way we've helped address that. The health district is also working in collaboration with clinics to recruit. Recruiting is a tough process. It's complicated, it's expensive, it takes lots of time, hours. And as an individual physician or even as a clinic, it's hard to get that done well. So increasing the collaboration between the health district, the hospital, and the clinics in the area, that has clearly improved our ability to recruit. Although we're far from where we need to be. We are still sorely short of providers. I guess the other piece of it just has to do with the health district helping with getting the word out. And I guess more than that, I'm probably forgetting one of the most important pieces, having a really high quality program at the hospital. If we have a very high quality program, if we are doing a great job on safety and effectiveness, giving people what they need for a reasonable cost, the better we are, the easier it's going to be to attract providers. The culture of a hospital is also important. When I say culture, I mean having people working in an environment where they feel like they're working as a team, where you're not always putting the blame on someone or battling against someone else. And that's a tough, it's building a good, strong culture is hard. We're working on it. We have a ways to go, but I think we're getting much closer than we were before. So there's really a lot the health district can do.
Describe your experience in reviewing budgets and understanding the financial resources and expenses necessary to manage a large health organization.
The majority of the experience that I have gained has been by being a board member. Before I joined the board, my understanding of the complexities of the finances of the hospital was really minimal. I mean, I understood the finances of my practice, and that was about it. I sat on the finance committee for a short period of time, and now I'm not an official member of that committee, but I attend every meeting because that's where all those issues get reviewed. We have members on the board now who are very experienced in finance and accounting, and I use them as a resource to help me understand all the details of what's going on. But in large part, I rely on the finance committee. And that committee, I have to emphasize, is made up of a large number of community members. So it's community members plus executive team plus board members. So it's the perfect place for community members to have participation in oversight and in decision making when it comes to the finances of the district. And we've done very well as a district, even during the pandemic year, during which lots of hospitals went under. We remain in a strong position, which took an incredible amount of really smart management.
In accordance with the hospital's mission to improve the health of our community every day, what is your vision of how the hospital can serve the community in addition to providing medical services?
I think it's really the role of the hospital more and more to help the community stay healthy. Historically, hospitals have been institutions where you come when you're sick and then you go home. And I think more and more we're in an era where hospitals need to actively work to keep community members out of the hospital. That is accomplished with community education programs, with health screenings, cardiac screenings, blood pressure screenings, cancer screenings, education on diet, nutrition, and improving access to primary care providers. The hospital shouldn't be the place people have to come to for primary care. And the hospital shouldn't be the place people have to come to if they have a minor medical problem or even a problem they're not sure about. It's really important to have a home base for your medical care. I think it's part of the responsibility of the health district to work towards increasing access to primary care providers, which we kind of talked about before. But really, I think hospitals are going to have to focus more and more on the community. The other thing the health district can do and is working on is working in collaboration with the rest of the community. I think in the past, it was sort of a silo by itself. You know, when you have clinics here and you have the hospital there, and how the hospital and the clinics need to work together. The collaboration is the key to all this, and connecting all those providers together helps make decisions that are best for the community. The new electronic health record system that's going to be going in, EPIC, and is a joint project between the hospital and North Bend Medical Center and Bay Clinic and Advanced Health. And that will improve things significantly in terms of improving instant communication between providers in the hospital. So I think the object is to kind of work towards a South Coast eco-health system rather than individual silos. We work better when we work together as a team than as individuals.
What would be the role of the hospital board in assuring that issues of diversity, equity, and inclusion are addressed not only within the hospital's personnel, but also in the provision of services?
I think that the role of the hospital, first of all, in hiring, is to have an approach that is basically equitable, that we strive to get diversity, although diversity in our community is not always easy, if you're looking at ethnic diversity. Having said that, that's part of our basic hiring, should be part of the basic hiring processes, which they are now. Patients should all be treated equitably, not only regardless of race or religion, but also of economics. You know, when I know there's a huge focus on diversity in the country, and one of the issues concerning diversity in our community, I think, has to do with economic diversity. We have folks that are really struggling in poverty, and we have folks that are wealthy, and those issues need to be addressed. We need to be able to take care of all those patients equally. You know, I always think about, when I think about the kind of care I want to see at the hospital, I think every patient should receive care like I would expect my mom or my dad or my husband or my child to receive. It shouldn't matter where you come from, who you are, what you look like. Everyone deserves the same care. Doesn't matter if you have private insurance, Oregon Health Plan, Medicare. Everyone should be treated with high quality, safe care.
Final.
All right, those were all of the questions, and I believe you're given 1 minute, 2 minutes, 2 minutes.
2 minutes, okay. I think I've
wrap
said
up.
most. I think I've said most of it already, but we'll have a go. And I'd like to go back to the fact that that I have been in healthcare my whole life, and it's been a major focus of my life. I took care of kids of all ages, babies, toddlers, teenagers, young adults, for 29 years at North Bend Medical Center. And during that time, I became close with those patients and their families, and I really learned a huge amount from them. I learned that families are really trying hard, that everybody wants to take care of themselves, and they don't always know how to do it, and they don't always have the means to do it. And I think that's the biggest challenge for our community. I think that everyone in this community must have access to safe, high quality health care. And that means adequate primary care providers, it means good hospital services, it means adequate nutrition. I mean, there's such a long list of all the things we need. We have so many chronic disorders, health disorders in our community. And the hospital plays a role in working with those conditions and tracking and helping people access the care they need. I would really like the opportunity to continue to be able to use my experience on the board and my experience as being a pediatrician in this community, taking care of all those folks. I would like to be able to continue to use that to work towards the goal of creating access to safe, quality healthcare to everyone.